This week we're gonna do some surgery, and this time it's gonna be outside of the operating room. Hi guys, my name is Zero Miller and I'm the host of this show, the Zero MD Show. The Zero MD Show is a show featuring medicine and public health in particular. If you were following me on Google+, Facebook or Twitter, you'd see that I posted a question 2 days ago. Who said this and why? An ounce of prevention is worth a pound of cure. The answer, ladies and gentlemen, is Benjamin Franklin. And no, he was not pertaining to any known disease, outbreak, or plague of his time. He was actually referring to fire. Yes, people, he was referring to fire. Back in 1736, Americans of his time that were struck by fire in their homes usually suffer irreversible economic loss. So the great Ben introduced the concept of fire insurance and promoted fire prevention instead of waiting for disaster to happen. Today, the statement stands as a motto for preventive medicine and public health. The shift of medical management today is preventing diseases instead of waiting for it, letting it happen and managing it through surgery, chemotherapy, or what have you. The sad part is that we cannot enforce or force people the preventive aspect of medicine. The patient has to have the choice to be disease-free. So to those who got the answer correct, good for you. It's probably a hard find in Wikipedia nowadays. Unfortunately, I wanted to give you a prize, however, I don't have enough funds for a door prize right now. Instead, I'll be giving a video shout out if I get your social media handler before I upload this video. Right now, since I posted the question, I got the correct answer from my Tita Montserrat Washburn from the States, who answered it correctly, Benjamin Franklin. So here's a shout out to you, Tita Montserrat Washburn. You're the greatest, and thank you for being a fan of the Zero MD Show. Now, let's do some surgery. Now, the case presented to me is a 45-year-old male with a chief complaint of a fluctuant mass in the first digit of the left foot. 3 weeks prior to consult, patient remembers stepping on a nail, and he sustained a puncture wound that he remembers that it did not bleed. The site of the puncture had erythema and was painful for the next 2 weeks. Few days, however, prior to consult, he had a fever of 38.9 degrees Celsius. The swelling began and the pain worsened, which prompted him to seek consult at our facility because he had little money. And a friend advised him that that mass that is growing in his first digit in the left foot is probably an abscess, and it's better to have it operated than to wait for it to break out. And actually, that was a good advice. He should have done it a few weeks ago. The operation is going to be called IND, which is short for Incision and Drainage. On YouTube, I have watched a ton of this IND uploaded by other doctors. They were beautifully done, and the procedures were all by the book. If my patient is to go to a surgeon, however, here in the public hospital here in Olongapo City, the patient will be spending, according to my other patients, an amount equivalent to 1,500 Philippine pesos, which is inclusive of the use of the minor surgery OR and all the sterilized equipment, instruments, and dressings. Just so I can make you guys understand the situation, 1,500 is actually equivalent to at least 35 US dollars. But the problem is that the poor people in my area of practice have an average income per month per person working in the family of only 3,000 pesos and below. I receive a lot of patients like this in my practice, and I believe them when they say that they can't afford a simple incision and drainage procedure to be done in the hospital, because the procedure price of 1,500 is actually half of their monthly salary. Now, what's with all this lengthy intro before the video? Because what I'm about to show you is considered by most surgeons nowadays to be barbaric and outdated. Because the surgery I'm about to show you is not by the book. You see, these patients come to me with nothing and with this type of burden to bear. If I don't do it, who will? If I refuse and they go to a hilot or a witch doctor for what they call a patandok, they may have a much worse fate than just having a simple abscess. And that is going to fall up like a burden to my conscience. Now, I don't charge anything for these procedures because these people are poor. And often I ask them to buy the materials outside or rummage through free materials or those that were used in medical missions, medical and surgical missions. Now, through this, they usually spend about 10 times less, sometimes free, as I'm going to show you in this video. Now, here's a shot of the patient's foot. The flapping of the foot is not really a tremor, but it's more of just plain anxiety. The patient is very, very scared of the procedure. And I explained to him that I have done this operation before to a lot of patients, and that his reaction is actually normal. You are going to see that as the operation goes on, that little flapping tremor disappears as he realizes that it's not as painful as he thought it was. Now, in my clinic in the rural health area, I don't have surgical drapes. So usually I improvise using the paper packaging of the sterile gloves or the sterile gauzes, just so I can limit the surgical field. Now, in this patient, since he has no money for the gloves nor for the gauze, we opted to just do without them. We had to rummage through other health centers for donated gloves or sterile OS. Now, the patient was given tetanus toxoid also prior to this procedure. Now, this was free, of course, through the efforts of the regional department of health. I try as much to mimic the proper procedures for a modern incision and drainage. So in this patient, I started by painting betadine on most of the first digit and then the surrounding area. This is actually a crude aseptic technique, I know. I then proceed to apply 3 cc's of lidocaine around the mass to be operated on to create a circumscribed area of anesthesia. I would have chosen for a digital block instead, but this was faster. I wanted to be done with this procedure in less than 10 minutes because of the long queue of patients already waiting in the OPD. Now, my blade of choice, as it is with other surgeons, is the surgical blade number 11 because it's pointed and the blade can easily go through the center of the abscess. Unfortunately, according to the patient and his relative, the whole city was devoid of this commercially available surgical blade number 11. Then I realized that the blade used or was given to me was surgical blade number 16, and it was a loan from a friend they knew in the hospital. So in all, this patient actually spent no money for this procedure. Now, using the wrong blade can pose some problems. Like me, in this procedure, I wasn't able to go straight into the abscess center. But I was still able to puncture the wound, and and about 30 cc's of foul-smelling pus came out of the mass. Now, using the wrong blade this way, using my hands to pinch the blade, is not recommended. So kids, don't do this at home or at all. Let us doctors or surgeons handle delicate procedures like this. You see, if I cut through my skin using the blade, it's going to pose some problems. Now we proceeded then to clean the wound. I used hydrogen peroxide first. I included the inside of the abscess crater to be cleaned with this fluid. Hydrogen peroxide actually denatures bacteria and some of the diseased tissue. In this way, hemostasis is facilitated. I do not, however, promote hydrogen peroxide because according to a lot of studies, hydrogen peroxide can delay wound healing. It's only in procedures like this during operation that we use hydrogen peroxide for hemostasis and for cleaning the wound. I then painted betadine on the surgical wound. This is supposed to create an aseptic layer to prevent bacterial growth and further pus formation. The wound, as with all IND, the wound is left open, and a thin layer of gauze was packed securely but never tightly. Bacteria that causes pus or abscess are usually anaerobic, which means that they die when oxygen is present. You want the wound to have access to oxygen, so you don't pack the wound tightly. Some pus may form after, and since the wound was left open, it will just continue to drain out. The patient is then instructed to replace the gauze as he sees fit. Now, this is a must. If you're going to do an operation, a minor operation like this, outside of a sterile field, like a minor, you have to give antibiotics post-op. I know surgeons usually do not prescribe antibiotics after a procedure like this because they have a very good aseptic technique. However, since we operated on this patient on a zero budget with little sterile equipment available, we have to use antibiotics. And from my history in PE, the choice was cloxacillin, and this was the right choice for this patient. Likewise, a pain reliever was then instructed to be taken at home. After 7 days, the patient followed up. Although he didn't follow up with me, he followed up with another rural health physician who happens to live near his house. They both reported that the procedure was okay and that the wound healed completely. However, this video is not really published to impress you, nor to give you guidelines for a DIY surgery, but rather to impress upon you that this is what we do with the poor. This is how we manage minor surgical ailments. It's a far cry from YouTube videos that I have watched, but these patients need these procedures. It's their last medical and surgical resort. Now that's all the time we have for today. If you have violent comments, I'm sure you probably do, or suggestions on how you can help me better manage the poor with surgery, you can leave them on the comments below. If you want more of me and the Zero MD show and more of this type of surgery, if you can still bear to watch it, and also medicine and public health, click that subscribe button below or this logo up top. Likewise, you can comment, like, or say hi to me on facebook.com/0million. Also, hook me up on Twitter sphere at twitter.com/0md. And if you are on Google+, I can be found in google.com/+0million. And that's it for this week, folks. I hope you learned something today. Again, thank you for watching. Bye-bye.